Have you ever felt your heart fluttering unexpectedly, like it's doing its own dance? Or maybe you've been told you have an irregular heartbeat but didn't think much of it. What if that tiny irregularity held a much bigger threat? Atrial fibrillation, often called AFib, is one of the most common heart rhythm issues in people over 60. Yet surprisingly, many seniors either don't know they have it or misunderstand its impact. Today, we're going to unpack what AFib really is and why it matters, especially for brain health and stroke prevention. Welcome back to the channel. Today, we'll explore a very important topic for health: the hidden link between atrial fibrillation and stroke in seniors. While AFib may sound like just a medical term, understanding it could save your life or the life of someone you love. If you or someone you know has been told they have AFib or an irregular heartbeat, drop a comment below and share your experience. You never know who it might help. The heart's electrical symphony, and when it falls out of tune. To understand AFib, picture your heart as a four-chambered orchestra. The upper chambers, the atria, keep rhythm and send signals to the lower ones, the ventricles, to pump blood efficiently. In a healthy heart, everything moves to a steady beat. But with atrial fibrillation, those upper chambers start to quiver instead of beating properly. The rhythm becomes chaotic, irregular, and often much faster than normal. Instead of lub-dub, the heart can sound more like lub, pause, lub. That irregularity creates serious challenges for your circulation and your brain. AFib. A silent visitor in the elderly. It's easy to imagine AFib as something dramatic. Maybe you expect it to cause chest pain or make your heart race wildly. But in reality, nearly 1 in 3 seniors with AFib feel no symptoms at all. That's why it's called a silent condition. A study published in the American Journal of Medicine found that about 40% of people with AFib were diagnosed incidentally, during a routine checkup or emergency room visit for something unrelated. This matters because AFib increases your risk of stroke by up to 500%. If you don't know you have it, you can't prevent the damage it causes. Why does the heart flutter with age? As we age, the heart, like the rest of our body, undergoes changes. The walls may thicken slightly, the electrical pathways may become less efficient, and the atrial chambers can stretch. This makes older adults more prone to irregular rhythms, especially if they have high blood pressure, diabetes, sleep apnea, overactive thyroid, a history of heart disease. But even without these conditions, aging alone can raise the risk of AFib. And in women over 65, the risk rises even faster. What AFib is not, and why that's important. It's important to clear up a common myth. AFib is not the same as a heart attack. A heart attack happens when blood flow is blocked to the heart muscle. AFib, on the other hand, is an electrical misfiring. Your heart is still beating, but out of sync. Yet AFib can set the stage for something just as dangerous: a stroke. In fact, about 1 in 4 strokes in seniors is linked to untreated AFib. That's why catching it early is so important. Different types of AFib. Some stay, some come and go. There are actually several forms of AFib. Paroxysmal AFib comes and goes, may last minutes or hours, then stop on its own. Persistent AFib lasts more than a week and needs treatment to stop. Permanent AFib. The heart stays out of rhythm long-term, and treatment focuses on managing it, not stopping it. Seniors often start with paroxysmal AFib and don't notice it. Maybe they feel a bit dizzy sometimes, or more tired than usual, and think it's just aging. But over time, episodes can get longer and more serious. Common misconceptions. I feel fine, so I must be fine. One of the biggest reasons AFib is underdiagnosed is that many people with it feel perfectly fine. Or they've felt a little off for so long it's become their normal. Here are some subtle signs that could hint at AFib. Slight chest fluttering or discomfort, not pain. Feeling lightheaded or faint occasionally. Low energy or fatigue, especially after light activity. Trouble catching your breath when lying flat. Mild confusion or forgetfulness. None of these symptoms are unique to AFib, but when combined, especially in older adults, they're worth discussing with your doctor. The stroke risk you can't see now. Here's the most important connection. When your atria don't beat properly, blood can pool inside the heart. And when blood sits still, clots form. These clots can travel through your bloodstream and get stuck in the brain, causing a stroke. What makes AFib strokes especially dangerous is they're often more severe than strokes from other causes. They can happen without warning. Recovery is often harder, especially in people over 70. That's why recognizing and managing AFib is about more than heart health. It's about protecting your brain, your independence, and your future. How AFib is diagnosed. Not just a stethoscope. If you're over 65, your doctor should regularly check for irregular heartbeats, but a single visit may not be enough. Some people have AFib only occasionally, so it may not show up during a regular checkup. Here are common tools used. Electrocardiogram, ECG or EKG, a quick test done in office. Holter monitor, a small device worn for 1 to 2 days to track your heart rhythm. Event monitor, worn for longer, up to 30 days, for people with very occasional episodes. Smart devices. Some smartwatches now have FDA-approved ECG features. Medicare often covers these tests, especially if you've had symptoms or are at risk. The emotional side of AFib learning that your heart rhythm isn't normal can be unsettling. You may wonder, is it dangerous? Will I need a pacemaker? Can I still travel or be active? The truth is, millions of seniors live full, healthy lives with AFib. But it starts with awareness, and then action. We'll talk more about treatments, lifestyle changes, and hope-filled stories in the next sections. In the next section, we'll dive deeper into why AFib often goes undiagnosed in seniors, and how to protect yourself even if you feel fine. Remember, you don't need to feel sick to have something serious going on. And early detection could be the key to living stronger, longer, and safer. Section 2. Why AFib often goes undiagnosed in seniors. Let's ask a simple but important question. If a health problem doesn't hurt, doesn't limit you, and doesn't show up in blood tests, how would you even know it's there? That's exactly the dilemma with atrial fibrillation in older adults. While it's one of the biggest risk factors for stroke, it often sneaks by quietly, without pain, without drama, and without clear symptoms. Many seniors live with AFib for years before it's finally found. Sometimes, only after a stroke occurs. In this section, we'll explore why AFib so often goes undiagnosed, and what steps you can take today to catch it early, protect your brain, and stay ahead of hidden heart risks. The surprising numbers. You're not alone. You're not the only one who might have never heard of AFib before a doctor mentioned it, or maybe you still haven't had that conversation yet. According to the CDC, over 5 million Americans live with AFib, and that number is expected to double by 2030 as the population ages. About 10% of people over 80 are living with atrial fibrillation, and many of them are unaware. One study published in Circulation found that at least 30% of seniors with AFib didn't know they had it until they were screened for another issue. This silent epidemic means many strokes in older adults, even fatal ones, could have been prevented with earlier detection. Why it's so easy to miss in seniors. There are several reasons atrial fibrillation often flies under the radar. 1. Symptoms are vague or missing. Unlike chest pain from a heart attack, AFib symptoms can be subtle. Many people feel light fatigue, shortness of breath only with activity. Slight dizziness, a sense of being off, but not sick. These can be easily mistaken for normal aging, or brushed off as just a bad day. 2. Symptoms come and go. AFib doesn't always stay around. In the early stages, episodes might last a few minutes or hours, then disappear for weeks. So unless your heart is monitored during an episode, standard checkups may not catch it. 3. Low pulse doesn't always mean low risk. Many older adults with a slow resting heart rate, especially those who walk or cycle regularly, think their heart must be strong. But AFib is about irregularity, not just speed. Some people with AFib have a heart rate that jumps up and down. 70 beats per minute 1 minute, 140 the next. That variation is the red flag, not just a high number. 4. Doctors may not always screen for it. Even though AFib is common, Some routine physicals don't include heart rhythm checks beyond a few seconds of stethoscope time. Unless symptoms are clearly reported or continuous monitors are used, many cases are missed. The role of cognitive changes. One clue that's often overlooked in seniors with undiagnosed AFib is a gradual change in mental sharpness. You might notice slower thinking, more senior moments, trouble finding words, mood changes like irritability. These are often blamed on aging or early dementia, but intermittent AFib can reduce blood flow to the brain, causing tiny silent strokes called microemboli. Over time, these impact memory, attention, and mood. If these symptoms appear with fatigue or shortness of breath, ask about heart rhythm testing. Case story. Tom, 74, the subtle wake-up call. Tom, a retired teacher, had been feeling a little more tired lately. He noticed his walks around the block were taking longer, and sometimes he'd feel slightly dizzy when standing up. But his blood pressure and cholesterol were fine, so he chalked it up to just getting older. Then, during a routine checkup, his doctor noticed a slightly irregular pulse and ordered a 48-hour Holter monitor. The results? Paroxysmal atrial fibrillation, short episodes that came and went, sometimes lasting only 15 minutes. Tom had no idea, but once diagnosed, he started treatment and made changes to reduce his stroke risk, all before any damage occurred. Screening tools that could save your life. Catching AFib before it causes problems doesn't require invasive tests, but it does require awareness. Here are tools you can use or ask about. Electrocardiogram, ECG or EKG. Simple, fast, and done in most clinics. But it only captures heart activity during that moment, so may miss occasional AFib. Holter monitor. A portable device worn for 24-48 hours that records every heartbeat. Great for catching intermittent AFib. Smart devices Apple Watch, Fitbit, and other devices now offer FDA-cleared ECG features. These can detect irregular rhythm episodes, especially helpful if you feel symptoms only sometimes. Pulse check at home. Learn how to take your own pulse as sit calmly. Place 2 fingers on your wrist or neck. Count beats for 60 seconds. If your pulse is irregular, skipping, speeding, or slowing randomly, talk to your doctor. Medicare and AFib detection. The good news? Many AFib screenings are covered under Medicare. Annual wellness visits include heart rhythm assessments. Holter monitors are covered if symptoms like dizziness or fatigue are present. Wearable monitors may be prescribed in some cases. If you're over 65, you can ask your provider for a screening, especially if you've noticed any symptoms, even if mild. Don't wait for a stroke to take action. Atrial fibrillation doesn't usually scream for attention, but its consequences can. That's why early screening is so vital. Every year, around 150,000 Americans die from strokes, many of which are linked to undiagnosed AFib. It doesn't have to be that way. If you've noticed any changes in your energy, mental sharpness, or pulse, or if you just haven't had a rhythm check in the past year, it's worth asking. You have the right to know what's going on in your body and the power to act before problems arise. A simple question for your next appointment. Before your next doctor visit, write this down. Can we check if my heart rhythm is normal and rule out atrial fibrillation? That one question could open the door to a longer, healthier life. In the next section, we'll explore exactly how AFib leads to strokes, the biological chain of events that begins with a tiny flutter in the heart and ends with a life-changing brain event. This knowledge can help you understand why treatment matters and how to talk to loved ones who might be at risk too. Section 3. The dangerous connection. How AFib causes stroke. Imagine your heart as a careful gardener, pumping fresh blood, full of oxygen and nutrients, to every part of your body. Now imagine that gardener suddenly becomes clumsy, spilling water in the wrong spots, and forgetting to water key plants. That's what happens when atrial fibrillation disrupts the heart's rhythm. It stops sending blood forward efficiently, and in the process creates the perfect setup for a stroke. In this section, we'll follow the journey from a single irregular heartbeat to a potentially devastating stroke. Understanding this connection is critical, not to scare you, but to empower you to take action before damage is done. Blood needs to move, or it turns into trouble. When your heart is in AFib, the upper chambers, the atria, quiver instead of beating strongly. This prevents them from pushing all the blood down into the ventricles. What happens next? Blood starts to pool in those upper chambers. That still, stagnant blood becomes a perfect spot for a clot to form. If a clot breaks loose, it can travel to the brain, blocking oxygen and causing a stroke. This process can happen silently and suddenly. A person may feel fine 1 minute and the next, they're unable to speak, move one side of their body, or even breathe properly. AFib-related strokes are often more severe. Here's what makes atrial fibrillation even more concerning. Strokes caused by AFib are often worse than other types of strokes. Why? The clots from AFib are usually larger. They often lodge in major brain arteries. They can block multiple branches at once. They tend to cause hemispheric strokes, affecting one whole side of the body or brain. Studies show that AFib-related strokes are twice as likely to be fatal and more likely to cause long-term disability. That's why even when AFib feels harmless, even when you don't feel anything at all, the risk it carries is real. What happens in the brain during a stroke? Let's walk through a simple breakdown of what happens when a clot from the heart reaches the brain. A clot forms in the atrium due to poor circulation. The clot is pumped out and travels through the bloodstream. It lodges in a cerebral artery, a blood vessel in the brain. Oxygen is blocked from reaching brain tissue. Within minutes, brain cells start to die. The affected area loses function, speech, movement, vision, or memory. The longer a stroke goes untreated, the more damage is done. That's why AFib screening and management are not optional. They are critical, the silent impact of mini-strokes. Sometimes AFib doesn't cause a full stroke. Instead, it can trigger transient ischemic attacks, TIAs, often called mini-strokes. These last only a few minutes to hours and symptoms may go away on their own, such as temporary slurred speech, numbness in one arm or leg, brief loss of vision, trouble understanding language. But don't let the word mini fool you. TIAs are often warning signs, and nearly 1 in 3 people who have a TIA will have a major stroke within a year if not treated. In seniors, frequent TIAs from AFib may also contribute to vascular dementia, a form of cognitive decline caused by repeated small clots reducing brain function over time. The real numbers and why they matter. Let's ground this in facts. Around 1 in 4 strokes in people over 65 are caused by AFib. If untreated, AFib raises your stroke risk by 400–500%. People with AFib are twice as likely to have a stroke recurrence within 5 years. And yet many strokes linked to AFib are preventable if the condition is detected and managed early. What increases stroke risk in AFib? Doctors use a scoring system called CHAQDDS2V-ASC to estimate stroke risk in people with AFib. Each letter represents a risk factor. C. Congestive heart failure. H. Hypertension. High blood pressure. A2. Age. 275. Counts double. D. Diabetes. S2. Stroke or TIA history. Counts double. V. Vascular disease. A. Age 65 to 74 SC. Sex category. Female gets 1 point. The higher the score, the higher the risk, and the more urgent it becomes to treat AFib proactively. How blood thinners help, and what to know. The cornerstone of stroke prevention in AFib is anticoagulation, medications that reduce the blood's ability to clot. Common medications include warfarin, requires regular blood tests. DOACs, direct oral anticoagulants like Eliquis, Xarelto, or Pradaxa. These medications lower stroke risk by up to 70%, but they must be taken exactly as prescribed and require a discussion about bleeding risks, especially in older adults. Your doctor will weigh your stroke risk versus bleeding risk and help you decide what's best. Are there natural ways to reduce risk? Lifestyle changes can't replace medications in high-risk patients, but they absolutely help reduce your overall burden and may prevent AFib from worsening. Lower blood pressure through low-sodium diet and exercise. Treat sleep apnea, which worsens irregular rhythms. Reduce alcohol intake, especially binge drinking. Maintain a healthy weight. Obesity strains the heart. Manage blood sugar and diabetes. Some foods rich in omega-3s, like salmon, chia seeds, or walnuts, magnesium and antioxidants may support heart rhythm stability, though they're not substitutes for treatment. What about surgical options? In some cases, especially if medications are not tolerated, your doctor may suggest procedures like cardioversion, a controlled electric shock to reset rhythm; ablation, a catheter procedure that destroys small areas of tissue causing abnormal signals; left atrial appendage closure, LAAC, a device implanted to prevent clot formation in the heart. These are more common in people who can't use blood thinners or have repeated AFib episodes. Your doctor will explain which options make sense based on your health. Summary: a chain reaction worth interrupting. Let's simplify it. AFib, blood pools in heart, clots form, clots travel to brain, stroke happens. But you can interrupt that chain with early detection, regular heart rhythm checks, proper medication, healthier daily choices. In the next section, we'll explore the real-life symptoms you might be ignoring. Those subtle signs that could be early hints your heart is out of rhythm. Many people chalk them up to normal aging, but knowing what's not normal could protect your future. Section 4. Real-life signs you might be ignoring. Let's take a pause from the science and step into real life. Picture a typical day. You get out of bed a little slower than usual. You're a bit winded walking from the bedroom to the kitchen. Maybe you forget where you placed your reading glasses. Again, no big deal, right? But what if these little moments weren't just aging? What if they were subtle signs from your heart that something deeper was going on? In this section, we'll talk about the everyday signs of AFib that often go unnoticed, not because they're invisible, but because they feel so ordinary. Recognizing these quiet signals could be the key to preventing a stroke before it ever has a chance. Why AFib doesn't always feel cardiac. When people think of heart problems, they imagine pain in the chest or arm, shortness of breath, or dramatic collapses like we see in movies. But atrial fibrillation rarely plays out that way, especially in seniors. Instead, AFib can show up as feeling tired, even after a good night's sleep, getting lightheaded during simple tasks, feeling your heart flutter or skip a beat when sitting quietly, a sense of foggy thinking or mental fatigue, periodic feelings of nervousness, even without stress. In older adults, AFib symptoms are often nonspecific and easy to blame on aging, low energy, or just one of those days. A closer look at subtle symptoms. Let's break down some of the real-life clues and how they might be linked to AFib. 1. Fatigue or unusual tiredness. This is the most common symptom of AFib in seniors, and also the easiest to ignore. People say things like, "I just don't have the energy I used to." "I need more naps lately." "I feel drained by noon, even if I slept well." Why it happens? When your heart is out of rhythm, it can't pump blood as efficiently. Your muscles and your brain aren't getting the oxygen they need. 2. Dizziness or feeling faint. This may strike when you stand up quickly, bend over, or even during a calm walk. Why it matters? AFib can cause blood pressure fluctuations and brief interruptions in blood flow to the brain. These can make you feel lightheaded or momentarily unsteady. A red flag, especially if it happens more than once a week. 3. Shortness of breath, especially during activity. Have stairs become more difficult lately? Do you avoid inclines or need more breaks while walking? Why it's related. The heart in AFib loses about 20 to 30% of its pumping efficiency. That means less oxygen gets delivered during exertion, leading to breathlessness and slower recovery. 4. Irregular pulse or flipping feeling in the chest. You may feel your heart skipping beats, racing suddenly, thumping without reason, or even fluttering like a fish in your chest. These moments may last seconds or minutes. Some seniors feel them as a tickle or butterfly sensation. Don't ignore them, especially if they're new. 5. Brain fog or mild memory lapses. This one surprises many people. If you feel slower to process thoughts, trouble recalling recent names or events, moments where you feel disconnected mentally. AFib might be subtly impacting your brain's oxygen supply. Even without a stroke, long-term irregular rhythm can affect cognitive performance. Stories from everyday people. Here are a few composite stories inspired by real-life seniors. Marilyn, 68. She'd always been active, walking daily with her sister. But recently, she found herself cutting walks short. She just didn't feel like it. One day, while sitting quietly reading, she felt a strange thud in her chest. Her smartwatch showed a heart rate of 132. She went in. The diagnosis? Paroxysmal AFib. Robert, 73. He noticed he needed to reread things more often. His thinking felt slow. At first, he worried about Alzheimer's, but tests came back clean. A routine visit caught an irregular pulse, and a monitor confirmed intermittent AFib. With treatment, his mental clarity improved within weeks. How do you know if it's just aging? That's the big question, right? Here's a simple self-check. Ask yourself, has this symptom changed in the last 6 to 12 months? Does it happen more than once a week? Is it new or getting worse? Do I feel different than others my age in the same situation? If the answer is yes to any of these, it's worth a deeper look. Aging is gradual, but AFib symptoms often show up in patterns, bursts, or step changes. Pulse check, a free daily test. You don't need fancy tools to catch a rhythm irregularity. You just need your fingers and a quiet minute. Here's how. Sit quietly for 5 minutes. Place your index and middle finger on the inside of your wrist, below the thumb. Count your pulse for 60 seconds. Ask yourself, is the pulse regular like a ticking clock? Are there any sudden skips, pauses, or racing moments? If it feels irregular or hard to follow, write it down and share it with your doctor. It may lead to further testing. Don't rely on blood pressure alone. Many seniors use home BP monitors and think, if my numbers look fine, my heart must be fine. Not quite. Atrial fibrillation can happen with normal blood pressure, and most BP machines don't detect rhythm irregularities unless they have a specific AFib alert feature. It's still worth using these monitors, but understand their limitations. They're a tool, not a full diagnostic device. When to get help immediately. If you ever feel sudden chest discomfort, a racing heart with dizziness, slurred speech, numbness in the face or limbs, sudden confusion, don't wait. Call 911. These could be signs of a stroke or a dangerous heart event. Minutes matter. What you can do today. Start a symptom journal. Track any days with fluttering, fatigue, or fog. Learn your resting pulse. Take it 3x week at the same time. If you use a smartwatch or fitness band, turn on rhythm alerts. Bring up your concerns during your next doctor's visit. Don't minimize how you feel. If it's new, it matters. The power of listening to your body. At 50, 60, 70, your body is still communicating. The signals may be quieter, but they're there. Learning to recognize subtle heart-related symptoms doesn't make you a hypochondriac. It makes you an advocate for your health. AFib isn't always loud, but the consequences of missing it can be. That's why every flutter, every odd heartbeat, every unexplained fatigue deserves your attention, and your doctor's attention. In the next section, we'll talk about how AFib affects brain health over time, including surprising links to memory decline and focus issues, even in seniors who never have a stroke. Section 5. How AFib affects brain health over time. Have you ever walked into a room and forgotten why you went in? Or found yourself grasping for a familiar word that just wouldn't come? While occasional forgetfulness is a normal part of aging, when these moments start to feel more frequent or more frustrating, they might signal something deeper, especially if you're living with atrial fibrillation. In this section, we'll explore the often overlooked connection between AFib and brain health. Even in the absence of a major stroke, AFib can have a subtle but serious impact on memory, mental clarity, and cognitive function. The heart and brain are more connected than most people realize, and keeping both strong means thinking beyond what you can feel. More than just a stroke, risk, most people understand that AFib can lead to stroke. But what many don't realize is that even without a stroke, atrial fibrillation can affect how your brain works, day by day, year by year. That's because your brain depends on steady, consistent blood flow. And AFib disrupts that flow, not always dramatically, but often enough to cause long-term issues. Brain fog, a common but overlooked symptom. Many people with AFib describe a kind of mental cloudiness. They say things like, "My thoughts feel slower. I can't concentrate like I used to. I feel mentally tired, even when I'm well rested." This isn't just psychological, it's physiological. When your heart is beating irregularly, oxygen-rich blood may not circulate efficiently to the brain. Over time, that can affect everything from decision-making to memory to emotional balance. A study in the Journal of the American Geriatric Society found that seniors with AFib had a significantly higher rate of cognitive decline, even without ever having a diagnosed stroke. The silent damage of microclots. While some clots from AFib are big enough to cause strokes, others are small, tiny, even microscopic. These microemboli can travel to small vessels in the brain, cause mini blockages that don't cause symptoms right away, lead to microinfarcts, areas where brain cells quietly die off. Over time, these microinfarcts can add up, resulting in memory loss, difficulty concentrating, slower reaction time, changes in mood or personality. Think of it like erosion, not one big landslide, but many little shifts over time. Vascular dementia, an underappreciated threat. When cognitive decline is caused by poor blood flow to the brain, it's often diagnosed as vascular dementia, the second most common type of dementia after Alzheimer's. Unlike Alzheimer's, which affects specific brain proteins, vascular dementia is often caused by chronic oxygen deprivation and damage from small clots or vessel disease. AFib contributes to this in 3 ways. Irregular rhythm reduces oxygen delivery. Microclots damage small brain vessels. Coexisting conditions, like hypertension, diabetes, compound the problem. Research shows people with AFib are over 40% more likely to develop some form of dementia than those without it. Signs of brain changes to watch. For these changes don't happen overnight, but they're worth watching for, especially if you or a loved one has AFib. Difficulty learning new things, getting lost in familiar places, trouble following conversations, changes in handwriting or spelling, mood swings, apathy, or withdrawal. Again, these are not always dramatic, but they represent a cognitive shift that deserves attention and early support. The emotional toll, anxiety and depression. Living with a heart condition like AFib can take a mental toll too. Not just because of what's happening physically, but because of the emotional weight of uncertainty. Many seniors with AFib report feeling anxious without clear cause, worrying about what might happen, pulling back from social activities, trouble sleeping due to worry. It's a natural response. The key is not to ignore it. Studies show that managing AFib effectively can improve both cognitive and emotional well-being, helping seniors feel more in control and less fearful. Can treating AFib help the brain? Absolutely. The sooner AFib is diagnosed and managed, the better the outlook. Not just for your heart, but also for your brain. Here's how treatment helps. Anticoagulants reduce clot formation, protecting brain vessels. Rhythm control strategies can restore more normal heart patterns, improving oxygen delivery. Lifestyle changes like improved sleep, better nutrition, and stress reduction all support brain function. One study in Stroke Journal found that AFib patients who were on blood thinners had significantly lower rates of dementia compared to those who were untreated. Brain-healthy habits that support your heart too. If you're managing AFib or at risk, these daily habits offer a double benefit. Eat for circulation omega-3 fats, salmon, flaxseed. Leafy greens, spinach, kale, berries for antioxidants. Beets and pomegranate support nitric oxide levels. Prioritize sleep. Poor sleep, especially sleep apnea, can worsen AFib and impair memory. Use a CPAP if prescribed. Stay mentally active. Learn something new weekly. Do puzzles, crosswords, or games. Engage in conversations and storytelling. Move your body. Walking just 30 minutes a day improves both heart rate and brain oxygenation. Movement also boosts mood. Manage stress. Chronic stress increases inflammation and AFib episodes. Consider meditation, deep breathing, or gentle yoga. Working with your doctor, what to ask. If you've been diagnosed with AFib and you're noticing changes in memory or focus, don't hesitate to bring it up. Here are some questions to consider. Could my symptoms be related to AFib? Should we evaluate my cognitive function? Is my current treatment plan protecting my brain as well as my heart? Are there other steps I can take to support brain health? If you're a caregiver, track changes in your loved one's thinking or mood and share those observations during appointments. A message of hope. Cognitive changes can be scary, but they are not always permanent. Many seniors with AFib see real improvements in clarity, energy, and memory once treatment begins and lifestyle habits are adjusted. Your brain is resilient, and your choices, today, can influence how sharp, present, and engaged you stay in the years ahead. In the next section, we'll introduce modern detection tools every senior should know about, including the latest in wearable tech, Medicare-covered screenings, and what to ask for during checkups. Section 6. Modern detection tools every senior should know. Imagine being able to detect a heart problem before it causes symptoms. Imagine spotting a dangerous rhythm while sitting in your favorite chair. Thanks to today's technology, that's no longer a dream. It's the new reality. In this section, we'll explore the modern tools available to detect atrial fibrillation early, from what your doctor may offer to what you can do right at home. If you or someone you love is over 65, this knowledge could mean the difference between catching AFib in time or missing it until it leads to stroke. Let's take the mystery out of monitoring and put the power in your hands. The problem with feeling fine. As we've explored, many people with AFib don't feel obvious symptoms. In fact, up to 40% of seniors diagnosed with AFib had no idea anything was wrong until it was discovered accidentally. That's why proactive screening is essential, especially if you have high blood pressure, diabetes, sleep apnea, a family history of stroke or heart disease, been feeling more fatigued or foggy lately. You don't have to wait until something feels wrong. You can start checking today, and here's how. The gold standard. ECG, electrocardiogram. This is often the first tool used to detect AFib. It records the electrical signals from your heart and shows irregular rhythm, abnormal timing between beats, any signs of strain or underlying heart conditions. It takes only a few minutes. Most doctors can do this during a standard appointment. Results are available immediately. The limitation? It captures just a snapshot in time. If your AFib comes and goes, paroxysmal, it might not appear during the test. That's why longer-term monitors are often the next step. Holter monitor, catching the rhythm over 1 to 2 days. Think of this as a 24-48-hour heart diary. How it works. You wear a small device with sensors on your chest. It records every beat of your heart during normal activities. You note any symptoms like dizziness, shortness of breath, or fatigue, useful for catching AFib that happens occasionally. Easy to wear. You go about your day as normal. If you're over 65 and have symptoms but no clear diagnosis, ask your provider about using a Holter monitor. Event monitor, tracking over weeks. For people whose AFib episodes are very occasional, say once every week or two, a longer-term event monitor may be prescribed. You wear it for 2 to 4 weeks. You push a button when you feel symptoms. Some even transmit data wirelessly to your doctor. These monitors offer a better chance to catch brief, rare episodes that could otherwise be missed. Smartwatches and wearable ECGs, the game changers. Thanks to technology, some of the most powerful heart tools are now available right on your wrist. Devices like Apple Watch, Series 4 and up, Fitbit, Sense, Samsung Galaxy Watch, Cardia Mobile, a portable ECG pad you touch with your fingers. These devices use built-in sensors to detect heart rate variability, irregular rhythm, Sudden spikes or drops. Some will alert you if they detect possible AFib and let you record an ECG to share with your doctor. These are not a replacement for a medical diagnosis, but they are excellent screening tools, especially if you're feeling off randomly, you're living alone and want extra safety, you want to track your heart over time. Medicare and insurance, what's covered? Many seniors wonder, will this cost me a lot? Good news, Medicare often covers AFib screening and monitoring, including ECGs during wellness visits, Holter, or event monitors if symptoms are present. Blood thinner medications, if AFib is diagnosed, remote patient monitoring tools in some cases. If your provider finds signs of irregular rhythm, even from a smartwatch, they can order further testing that is usually covered. Tip: call your plan provider or visit Medicare.gov to check exact coverage. In-home monitoring for peace of mind. There are also FDA-approved at-home ECG devices you can buy and use anytime. Cardia Mobile, by AliveCor, a pocket-sized ECG pad you touch with your fingers. Withings BPM Core combines blood pressure and ECG in one device. Omron Complete, a blood pressure monitor that also records ECG. These give you readings in under a minute. Results are stored in an app you can review or email to your doctor. Perfect for people who want regular independent monitoring without wearing a device all day. What to look for in a device. If you're shopping for a heart monitor or wearable, here are some features to prioritize. AFib detection, not just high or low heart rate alerts. ECG recording, 1 lead or 6 lead. Easy-to-use interface data sharing with physicians. Battery life and comfort for daily wear. You don't need the fanciest model. You just need one that helps you track what matters. Rhythm, irregularity, and your peace of mind. Building a heart monitoring routine. Here's how seniors can incorporate heart rhythm checks into daily life. Morning check. Take your pulse while sitting quietly with coffee. Use a smartwatch or manual method. After activity, notice how your heart responds to walks, chores, or exercise. Track any unusual fatigue or racing. Symptom journal. Keep a small notebook or app log. Time of symptoms. What you were doing, what your pulse felt like. Bring this to your next appointment. What to do with results. If you record or feel signs of irregular rhythm, here's what to do. Don't panic. Irregular rhythms aren't always dangerous. Note the time and what you are doing. If symptoms last more than 10 minutes or recur daily, call your doctor. If you feel faint, short of breath, or confused, call 911. It may be a stroke. Even one detected episode of AFib is enough for your doctor to investigate further. Empowerment through awareness. Technology is no longer just for the tech-savvy. These tools are for everyone, especially older adults who want to stay independent and informed. Remember, you don't have to feel sick to be at risk. You don't need a hospital to begin screening. You don't need to wait for symptoms to appear. Being proactive is being powerful. In the next section, we'll move from detection to daily actions you can take starting today to reduce your risk of AFib episodes and stroke. 7. Schedule regular checkups. You'd be surprised how many seniors don't have their heart rhythm checked regularly, especially if they feel fine. Make it routine. Ask for a pulse and rhythm check at every visit. Bring a symptom log if you notice fatigue, fluttering, or brain fog. Ask, could this be AFib? Even if your pulse seems normal, your provider may order an ECG, Holter monitor, or refer you to a cardiologist if needed. Remember, you're the best expert on how you feel. Speak up. Bonus, keep the heart-brain connection in mind. Everything you do for your heart also helps your brain. Better blood flow equals sharper memory. Fewer clots equals lower stroke risk. Stable rhythm equals steadier mood. If you've noticed cognitive changes or have a family history of dementia, addressing AFib now can help protect your independence and vitality. A simple daily routine to support heart rhythm. Here's a doable sample day for someone overseas managing AFib risk. Time action 7:00 a.m. Wake, stretch, and take pulse. 7:30 a.m. Heart-healthy breakfast, oats, berries, walnuts. 9:00 a.m. 20-minute walk outside, 12 p.m. Light lunch plus hydration, 2 p.m. Short rest or nap, 4 p.m. Gentle stretches or balance exercises, 6 p.m. Low-sodium dinner, minimal processed food, 8 p.m. Journaling or reading, dim lighting, 9:30 p.m. Sleep in a cool, quiet room. You don't need to be perfect, just consistent. Encouragement to take the first step. Don't be overwhelmed. Start with one change today. A short walk, a low-sodium meal, one less drink, a better bedtime. Then build on it. Each day, your actions tell your heart, I'm listening, I'm taking care of you. In the next section, we'll look at medications and natural supports for managing AFib and reducing stroke risk, including what's safe, what to ask your doctor, and what's backed by research. Section 8. Medication and natural support options. By now, we've learned how atrial fibrillation can be silent, sneaky, and serious, especially when it comes to stroke risk. We've also explored the power of lifestyle, but sometimes healthy habits aren't enough. And that's when medication steps in, not to replace your efforts, but to reinforce them. In this section, we'll walk through the most common medications used to manage AFib and reduce stroke risk. We'll also explore complementary strategies, the natural supports that work alongside medical treatment to help you feel your best. Our goal isn't to overwhelm. It's to equip you to have better conversations with your doctor and more confidence in your care. The two main goals of AFib treatment. Doctors manage AFib with two key targets in mind. 1. Control the heart's rhythm and rate, so your heartbeat becomes more regular and efficient. 2. Prevent stroke by stopping clots from forming and traveling to the brain. Let's look at the medications that help achieve both. 1. Anticoagulants, blood thinners. These are the most important drugs for people with AFib, especially if you're over 60. Why? Because AFib increases stroke risk by 4 to 5 times, and anticoagulants reduce that risk by over 70%. Common options. Warfarin Coumadin requires regular blood tests, INR, to adjust dose. Interacts with many foods, like leafy greens. Affordable, but more work to manage DOACs, direct oral anticoagulants. Newer options with fewer interactions, no regular blood tests. Examples. Eliquis, Apixaban, Xarelto, Rivaroxaban, Pradaxa, Dabigatran. More predictable, but can be more expensive. Important. These do not thin your blood. They reduce the blood's ability to clot. That's why they must be taken exactly as prescribed and not stopped suddenly. 2. Rate control medications. These drugs help slow down a racing heart, especially if AFib is causing high pulse and breathlessness. Common options. Beta blockers, metoprolol, atenolol. Calcium channel blockers, diltiazem. Verapamil. Digoxin, less common now, but used in some older adults. These don't fix the rhythm. They just help the heart beat slower and more steadily, reducing symptoms like fatigue and palpitations. 3. Rhythm control medications, antiarrhythmics. If your doctor wants to restore normal rhythm, they may try medications called antiarrhythmics. Examples. Flecainide, amiodarone, sotalol. These can be effective, but require careful monitoring for side effects, especially in seniors. Some are started in the hospital under supervision. Not everyone needs rhythm control drugs. Your doctor will decide based on your symptoms, how long you've had AFib, your heart structure and strength. 4. Cardioversion and ablation, if meds don't work. If medications don't control your AFib well or cause too many side effects, your doctor may suggest cardioversion, a quick controlled electrical shock to reset your heart to normal rhythm. Done in a hospital under light sedation, often used if AFib is newly diagnosed. Ablation, a catheter-based procedure where tiny areas causing abnormal signals are burned or frozen, can help people who don't tolerate medications well. More common in younger patients, but possible for healthy seniors too. Both are safe and increasingly effective, especially when paired with lifestyle changes. Important considerations for seniors. Older adults need extra care with medications due to kidney function affects how drugs are cleared, fall risk, blood thinners increase bleeding risk, memory, adherence is crucial, other medications to avoid harmful interactions. That's why your provider will often do kidney function tests, blood pressure checks, medication reviews. Tip: keep a current medication list with doses in your wallet or phone. This helps in emergencies and appointments. Can natural options help? Let's be clear, natural remedies are not a substitute for anticoagulants or prescribed treatment, but they can offer support, especially when approved by your healthcare provider. Here are some well-studied natural supports. 1. Omega-3 fatty acids found in fatty fish, salmon, sardines, flaxseed oil, chia seeds, walnuts. Some studies suggest omega-3s may help reduce inflammation and support electrical stability in the heart. Caution: high-dose omega-3 supplements can increase bleeding risk if you're on blood thinners. Talk to your doctor before adding. 2. Magnesium supports electrical conduction, muscle relaxation, blood pressure, regulation as sources, spinach, pumpkin seeds, avocado supplements if levels are low. Ask your doctor to check your magnesium before supplementing. Too much can be harmful. 3. Hawthorn crataegus, a traditional herb used in Europe for heart health. Some small studies show benefits in improving circulation, reducing mild heart symptoms, but it can interact with heart medications. Always clear it with your provider. 4. Coenzyme Q10, CoQ10, supports cellular energy in heart muscle. May reduce fatigue in some AFib patients, often used by those taking statins, cholesterol drugs, that lower natural CoQ10 levels. Again, always disclose supplements to your healthcare team. What to avoid: some natural substances can be risky for people with AFib, such as licorice root can raise blood pressure and potassium. St. John's wort interacts with blood thinners and other meds. Ephedra, huang, a stimulant that can trigger arrhythmia, grapefruit, interacts with many medications, especially blood thinners and statins. When in doubt, ask. Your heart deserves careful choices. Questions to ask your doctor. At your next visit, consider asking, do I need a blood thinner based on my risk? What's the best rate or rhythm control plan for me? Are there safer medication options at my age? Can I take magnesium, omega-3s, or CoQ10 with my prescriptions? What signs should make me call you right away? Being informed helps you feel in control, not at the mercy of your condition. Combining medication with daily action. Remember, pills alone don't create health. They buy time to make lifestyle changes, build strength, and stabilize the heart from the inside out. A successful AFib plan combines medications prescribed appropriately, lifestyle shifts, movement, nutrition, sleep, monitoring to catch changes early, support from loved ones and care teams. You're not just managing a condition, you're protecting your future quality of life. In the next section, we'll share real-life stories of seniors who've caught AFib early and now live full, active lives, plus their secrets to staying motivated, informed, and hopeful. Section 9. Living with AFib. Stories of hope and management. When you first hear the words atrial fibrillation, it can feel overwhelming. You might imagine limitations, medications, or frightening complications. But what if we told you that many older adults live full, joyful, and active lives with AFib? Not just despite it, but because they chose to engage with it? In this section, we'll share real-world stories of seniors who've been diagnosed with AFib and found not just stability, but new strength. These stories are based on composite examples from real-life experiences, showing what it looks like to live well with AFib. Day by day. Joan, 72. I was just tired all the time. Joan was a retired nurse who had always cared for others. But over a few months, she began feeling off, unusually tired, breathless climbing stairs, and sometimes lightheaded in the afternoon. She assumed it was just aging, until her daughter noticed her heart racing during a hug. Joan went in for a checkup and a Holter monitor revealed intermittent AFib episodes. With support from her cardiologist, she started a blood thinner to reduce stroke risk, adjusted her sleep schedule and was tested for sleep apnea, began walking daily with a friend for 20 minutes. Now, 2 years later, Joan says, "I didn't know how tired I really was until I got treated. Now I feel like I have my spark back." Louise, 76. "I was scared of the meds, but they gave me my life back." Luis, a widower and retired firefighter, was diagnosed with AFib during an ER visit for dizziness. His doctor recommended anticoagulants, but he was worried about bleeding risks, especially since he loved gardening and working with tools. Together, they created a careful plan. He started Eliquis, a newer blood thinner with fewer food interactions. He kept a symptom log and invested in a smartwatch. His doctor reviewed all his medications to reduce any interactions. Luis also began chair yoga at a local senior center, joined a community walking group, took a CPR class to feel more empowered. Today, he says, "I don't live in fear anymore. I live with awareness. That's the difference." Margaret, 68. "It felt like nothing until it was something." Margaret had no symptoms, no chest pain, no fluttering. She went for her Medicare annual wellness visit, and her doctor noticed a slight irregularity in her pulse. An ECG confirmed early-stage paroxysmal AFib. She was shocked. "I didn't feel anything. I would have never known." Her provider ordered a 14-day event monitor to confirm, started her on a low-dose beta blocker, recommended gentle daily exercise and a Mediterranean-style diet. Margaret now teaches a community class called Know Your Rhythm, encouraging others to listen to their bodies and not ignore checkups. Story 4. James, 80. "I thought I had dementia." James had been forgetting things more often: names, appointments, even where he parked. His wife was concerned, thinking it could be early Alzheimer's. His primary care doctor ordered cognitive tests and also noticed an irregular heart rhythm. A full cardiac workup showed chronic AFib, likely present for over a year. It had reduced his brain's oxygenation and contributed to his symptoms. After starting treatment, his memory noticeably improved within 3 months. His mood lifted. He joined a local choir to stay mentally and socially active. James says, "It wasn't dementia, it was my heart, and I'm so grateful we caught it in time." Key lessons from real people. From these stories, we see common patterns that you can apply in your own life. 1. Don't wait for dramatic symptoms. Fatigue, fog, or just feeling off are enough to ask for a rhythm check. 2. Mental changes may be heart-related. Cognition and circulation go hand in hand, especially in seniors. 3. Treatment equals more energy, not just fewer risks. Many patients feel better, more alert, active, and emotionally balanced after starting care. 4. The annual wellness visit is a powerful tool covered by Medicare. It's a chance to catch conditions like AFib early, even without symptom. Words of encouragement. From seniors to seniors, here are some quotes we gathered from AFib support communities and patient groups. Don't be afraid of the diagnosis. Be afraid of ignoring it. Nancy, 70. "I thought blood thinners would slow me down. They actually gave me more peace of mind to enjoy my life." Mark, 74. "My smartwatch saved me. I didn't know it could do that. Now I tell everyone to wear one." Jeanette, 67. "I've learned more about my health in the last 2 years than I ever did in 60. Roy, 81. "Staying motivated for the long haul." Like any chronic condition, AFib isn't a sprint. It's a marathon. But the good news, you're not running it alone. Here's how seniors stay engaged and positive. Support groups, in person or online. AFib forums, Facebook groups. Health buddies, a friend or family member to share updates with. Progress journals, tracking pulse, symptoms, activity, and mood. Mini goals. Walk 15 mins today. Try one new recipe. Ask one new question at my next visit. Celebrating small wins helps you stay consistent, and that's what leads to big change. How caregivers and families can help. If you're the child or spouse of someone with AFib, your role is powerful. You can attend appointments or help take notes remotely. Remind about medications or refill calendars. Track symptoms when your loved one forgets. Support lifestyle changes by joining in walks or healthy meals. Encourage screening even when there are no symptoms. The more involved you are, the more confident your loved one will feel. A word of hope. Life after the diagnosis. Living with AFib doesn't mean giving up your hobbies, freedom, or joy. It means learning to monitor wisely, move mindfully, nourish consistently, stay connected, ask for help when needed. You don't have to be perfect. You just have to stay in tune with your rhythm, both physically and emotionally. In the final section, we'll wrap up this series with a practical checklist to talk to your doctor, what to ask, what to share, and how to advocate for yourself or your loved one with confidence. Section 10. When to talk to your doctor. You've come a long way. You've learned what AFib is, how it affects your brain, how to spot its subtle signs, and how to take action. Now the final and most important step, knowing when and how to talk to your doctor and what questions to ask. Many people wait too long, hoping symptoms will go away. Others don't ask questions because they don't want to seem difficult. But you deserve answers. And the earlier you speak up, the more options you have. Let's talk about how to start the conversation, what to share, what to ask, and how to make the most of every visit. Start with what you've noticed. Even if it feels small. Doctors are trained to look for patterns, and your observations help create those patterns. Here are some examples of symptoms worth mentioning. I've been feeling more tired lately, even with sleep. Sometimes I feel lightheaded or my heart races for no reason. I've noticed my thinking feels foggy. Is that just age? My smartwatch said I had an irregular heartbeat. Should I be concerned? You don't need to make a self-diagnosis. Just describe what you've noticed. Let your doctor connect the dots. Create a simple symptom log before your appointment. Even just 7 days of notes can help your doctor spot AFib or rule out other issues. Here's what to track. Date, symptom, time of day, activity. Heart rate, if known. July 1st. Fluttering in chest. 10 a.m. Sitting 105 BPM, July 2nd. Dizzy, brief, 8 p.m. Watching TV, 92. BPM, July 3. Tired all day. Normal day. 78 BPM. Bring this to your visit or show it from your phone. What tests should you ask about? If you're over 65 and experiencing any changes in energy, memory, or heart sensations, you can ask about ECG, electrocardiogram, a basic rhythm snapshot, Holter monitor, for irregular rhythms that come and go, event monitor, for rare or hard-to-catch symptoms, sleep study, if snoring, fatigue, or apnea are concerns, cognitive screening. If you've noticed thinking or memory changes, these are non-invasive, usually covered by Medicare, and can be life-changing when they catch something early. Key questions to ask your doctor. Sometimes we freeze during appointments. Here's a helpful list to print, bookmark, or bring along. If you have symptoms but no diagnosis yet, could these symptoms be related to my heart rhythm? Should we check for atrial fibrillation? What kind of monitor would help us catch it? Is it safe for me to be physically active while we figure this out? If you're worried about brain function, could AFib affect my thinking or memory? Should we check for cognitive changes now to track over time? How can I protect my brain while managing AFib? If you've been diagnosed with AFib, what's my stroke risk score, CHHA2DS2 VA ask? Should I be on a blood thinner? Are there safer medication options for my age? What side effects should I watch for? Do I need to see a cardiologist or specialist? If you're interested in natural support, can I take magnesium or omega-3s with my current meds? Do any of my supplements interfere with AFib or blood thinners? What lifestyle habits will make the biggest difference? Bring someone with you. It helps more than you think. Whether it's a spouse, child, friend, or caregiver, having a second set of ears makes a big difference. They can help you remember what was said, ask follow-up questions you didn't think of, provide context about changes they've seen in you, Many doctors also allow family to join via speakerphone or video if they can't attend in person. Don't be afraid to ask again or ask for clarification. If something doesn't make sense, it's okay to say, "Can you explain that in simpler terms? What does that mean for me specifically? Can we write that down together or go over it again?" Good doctors welcome your questions, and great ones teach as they treat. Tools to help you stay on track. Here are some free or low-cost tools to help manage AFib or stroke risk. Apps. My Chart from your hospital or clinic. Cardia for ECG tracking. MediSafe for medication reminders. Printable trackers. Blood pressure logs. Symptom calendars. Pill schedules. Ask your clinic for handouts, or visit sites like heart.org for downloads. A message to caregivers. If you're helping someone navigate AFib, here's how to support their doctor visits. Help create the question list before the visit. Listen for what the doctor does not say. Take notes or ask for a printed summary. Help track medications and side effects at home. Speak up. Your insights matter just as much. Many seniors don't express how they really feel. Your voice could be the key to better care. Red flags that need urgent medical attention. If any of the following happen, call 911 or go to the ER immediately. Sudden numbness or weakness, especially on one side of the body. Slurred speech or confusion. Vision changes or sudden dizziness. Severe chest pain. A racing heart that won't slow down or causes fainting. AFib-related strokes can be fast and severe. Time eats brain. Every minute counts. You deserve answers and a plan. Managing AFib isn't just about avoiding the worst-case scenario. It's about feeling better, thinking clearly, living longer, staying independent, enjoying your relationships and routines. The first step is talking to your doctor, your family, and your own heart. If this video helped you feel more empowered, please share it with someone you care about. Subscribe to Healthy Aging to be your companion on the path to strength, clarity, and confidence every single day.